Welcome back. You're still tuned in to News and Views with myself, Salalo Makwidir. The time is 2 minutes after 9, and I will now be shifting our focus now to the KZN, where the KwaZulu-Natal Department of Health has reported a concerning rise in case of hand, foot, and mouth disease, with 168 confirmed cases across several districts. The outbreak is primarily affecting young children in schools and daycare centers, and raising concerns among parents and educators about how to contain the spread. And joining us now to help us unpack and understand this outbreak and its symptoms, how it spreads, and what can be done to prevent it, is medical officer at the NICD Outbreak Response Unit, Dr. Saffiya Umar, and she'll be joining us via a virtual platform. Doc, Jazakallah so much for joining us this morning, and really, really appreciate you giving us your time. And hope we have a really insightful conversation that the community can learn and benefit from.
Assalamu alaikum, and just thank you so much for having me on your show. And yes, I hope that this can be a very informative session for your viewers.
I think first and foremost, can we start with some of the confirmed and latest numbers of the reported cases of this hand, foot, and mouth disease in KwaZulu-Natal, and what are some of the districts that are most affected?
So, absolutely. So, the KZN Department of Health, specifically the eThekwini municipality, are currently on the ground, and they're leading and coordinating the outbreak response as we speak. Because hand, foot, and mouth disease is such a mild, self-limiting illness, surveillance, or it's actually not mandated to be a notifiable medical condition. So we actually have very little surveillance data on hand, foot, and mouth disease. So the numbers may be alarming, but having said that, because it's such a mild and self-limiting disease, we do have documented outbreaks that have happened in South Africa previously, as well as globally. So that's the first sort of message that we want to spread, that there's no need for panic. In terms of the most affected areas, it would be your eThekwini municipality that's having or recording the highest numbers. But as I said, the KZN DOH are on the ground, and we're actually looking forward to seeing their surveillance data on this current cluster of cases.
What is the current understanding of how this outbreak started and how the disease is spreading? And are there any, suspected sources of infection?
So the viruses responsible for causing hand, foot, and mouth disease are commonly circulating viruses, and not only in South Africa. They're circulating all over the world. And these particular viruses are responsible for this cluster of cases. And you rightly said, they occur commonly in creches, schools, especially during the summer and autumn months. So the only actually known reservoir that we have for these viruses is humans. So they are asymptomatic carriers in our communities, and again, globally as well. And what an asymptomatic carrier is somebody who actually has the virus in their body, and they are spreading it around by droplets. So coughing, sneezing, or the fecal oral route is another route of transmission. And they are basically people who have the virus in them, are able to spread it, but they don't physically get ill from it. So that's the only known reservoir for this virus.
Let's talk about something that I feel like is going to be important, for those that are listening, particularly parents that have children that go to daycares and primary schools. The primary symptoms that parents and maybe educators also should be looking out for, and at what point should they seek medical attention for their children or anyone that is suspectedly infected?
Okay, absolutely. That's a very important question. So it is an illness caused by a virus. Usually the symptoms are mild and self-limiting. And when I say self-limiting, I mean that by 7 to 10 days, most of your symptoms should have cleared. What parents, educators, community members need to look out for is a fever. Okay, that's the first sign that you would see. Little children who aren't able to verbalize that they're not feeling well might show a little bit of irritability, or they might be very tired. So a child that's not playing normally or not behaving as they usually would is usually a sign that they're not feeling great. Then within the mouth and the mucous membranes, there might be blisters or sores that form in the mouth. So older children can complain they have a very sore throat, but these blisters do make it very painful to eat and drink. And so this is sort of one of the things parents or community members do need to look out for. And then the last sign or symptom that you're going to see is this rash that develops on the hands. So it's on the palms as well as the soles of the feet. So again, usually by 7 to 10 days, most of the symptoms should be cleared. However, you should, firstly, there's nothing stopping you from seeking medical care if anything is of concern to you. But some of the things that you do need to look out for is very severe symptoms. If there's very high fever and the fever isn't going away after 3 days, if the symptoms haven't resolved by 7 to 10 days, then please absolutely seek medical care to exclude any other medical conditions that may mimic hand, foot, and mouth disease. If you have very young children, so less than 6 months of age, I would suggest seeing a healthcare practitioner. And another important thing is to watch out for is if your child is unable to eat, drink, swallow, because then they're prone to getting dehydrated, and then you must seek medical attention. Another consideration is if your child has a chronic medical condition which weakens their immune system, then please absolutely go ahead and see a medical doctor. And again, if you're concerned about absolutely anything with your child's health, please do seek care.
Mm, mm, mm. What public health measures are in place to control this outbreak? Is maybe vaccination an option, or is this primarily about hygiene and just containment?
Yes, so there currently is no specific treatment for hand, foot, and mouth disease. There's no vaccine available, and it is a viral illness. So the mainstay of our treatment, so it can be treated, is that we target the symptoms. So if your child has a fever, we're obviously going to treat the fever, and this can be done with over-the-counter medication like Panado, tepid sponging, removing layers of clothes of the child. As I've mentioned previously, ensuring that your child is eating adequately, drinking is very important. And then also, again, over-the-counter medication are very helpful, again, like paracetamol for sore throat, etc. The mainstay of management, or one of the biggest things, is prevention and control of the transmission. And from what we know about how the disease is spread, the most important thing is educating our communities, our schools, as well as children about hand washing. It's very important to teach proper techniques about hand washing. So using soap, using water, keeping your hand under the water for longer than 20 seconds. Other important things about hand washing is just to get our children, community members into the habit of washing your hands after you use the toilet, washing your hands before you eat. If you cough or sneeze and it happens to be in your hand, wash your hands immediately afterwards. Again, teaching good respiratory hygiene, like coughing or sneezing into a folded elbow, is very important. And during a time like now where there's a cluster of cases, it's very important that we disinfect and that we continuously clean surfaces or very high traffic areas, especially in schools and creches. So door handles, tables, toys that are shared objects, utensils, anything that is shared between the children. It's very important to disinfect and clean those properly. Another transmission route, and this would be very important in young children, creche or kindergarten age, is the fecal oral route. So it's important for us to teach our caregivers that once they've assisted a child with changing a nappy, it's very important to wash your hands before you go on to prepare food or to assist other children or touching surfaces. And something that I think a lot of us do habitually is touching our face.
Mm.
And we know that the virus actually enters the body through the eyes, nose, and mouth. So It might seem like sort of simple measures, but those are the mainstay of preventing the transmission and propagation of this illness.
No, definitely. I think we're going to leave on that note. Dr. Saffiya Omar, thank you so much for your insights and for this very, very educational segment for our communities. And I hope we chat in the not so distant future. Really appreciate it.
Thank you so much. Take care. Assalamu alaikum.
Walaikum salam. There you have it. That was a medical officer at the NICD, their outbreak response unit, Dr. Saffiya Omar. And yeah, she was just breaking down this latest outbreak of hand, foot, and mouth disease, which is highly contagious, particularly among young children. But as you've heard, it can be effectively managed through simple but yet very, very crucial hygiene practices: regular hand washing, disinfecting surfaces, avoiding the sharing of personal items, and keeping sick children at home are all very, very essential steps in preventing the spread of the disease. Parents, teachers, and caregivers, I think, play a very, very vital role in ensuring that children are protected, and public awareness is key in stopping further infection. So let's all do our part in promoting good hygiene and safeguarding the health of our communities. We've done it through COVID, and we can do it this time. And what's concerning for me is the fact that this is mainly affecting children, man, and some of them can't even express how they're feeling. And yeah, I think it's a sad, sad scenario. But yeah, just make sure that your kids wash their hands. Make sure that you also practice that. You know, we were sanitizing and washing our hands a lot during the COVID-19 pandemic, and we shouldn't have stopped. We need to continue on that route. Make sure that you have your mask when you're not feeling well. Cough on the inside of your elbow, and yeah, just keep good hygienic and sanitary traditions, and we can mitigate this outbreak of hand, foot, and mouth disease, which is spreading quite rapidly, particularly in the KZN region. And yeah, a big thank you again to Dr. Saffiya Omar for shedding light on this outbreak, and to our listeners for tuning in. Let's stay safe, let's stay informed, and remember, prevention starts with good hygiene. Just washing your hands, sanitizing, putting on a mask when you're not feeling well, and protecting yourself and those that are around you. We're going to take a quick break. When we come back, news and views continues.